Hi everyone, my name's Bryanna and I'm the manager of social media here at BioPro Armour, and I'm back with Dr. Warren today for our next episode of Ask the Vet. And I figured that today we would discuss pulse electromagnetic field therapy because I know that it's had a profound impact on many horses, and Dr. Warren was actually one of the first people to introduce it to the racetrack for racehorses. So I'm excited to learn about it today. How are you doing, Dr. Warren?
Doing great, Brianna. How about yourself?
I'm doing well, doing well.
Oh, good. Did you have a lesson this week?
I actually didn't because my friend was having to deal with some issues around her barn, so I ended up not being able to go, but
Uh,
looking forward to getting to see her again.
Next week's another time.
Yep, yep.
Well, great. Well, what's on the mind today? We got the PMF.
Yep.
Okay, let's get started. Uh,
So,
back in 1998, at the racetrack, you're always looking for something new.
yeah.
And back in 1998, a friend of mine who was a chiropractor introduced me to this machine that he had been working with called Papimi. It was made in Greece, and it's a big machine. It's a 300-pound machine, um, but it was developed by a physicist in Greece uh, to essentially they were using it for was to find broken cables in the Atlantic. But and the result of that, the person that was working with him had cancer, and over the period of 3 or 4 or 5 years they took to develop this machine, he was free of cancer. So that was the main reason they built this machine, to try to treat cancer, which it does, I'm
Oh.
sure. I can't say that because the FDA doesn't like you to say those kind of things. But so anyhow, he brought this machine around. There was an outfit in Los Angeles that imported the machine. They were the only ones importing machines. It was the only PEMF machine in America at the time. It was a brand new concept. And what happened was, Dave Hand was the name of my partner. He came out and he would do his chiropractic techniques on these horses, loosen up the muscles and everything, and then he would treat them with the Papimi, which is a PEMF machine with all of the frequencies necessary to treat the horse's system. Some of these machines that have been come since then of knockoffs don't have all those frequencies, and consequently, some of them are nothing more than muscle stimulators. If your machine is causing a great deal of fasciculation in the muscles where it's really making them cramp, that machine doesn't have much good as far as I'm concerned, because it's mainly a muscle stimulator. It doesn't have the magnetic ability to heal what we've been healing with this other machine. Well, make a long story short, we went along for several years.
Mhm.
Incidentally, I am a certified PEMF operator. We went to they put a school together. We had to uh, be licensed to be able to use this machine in public. In the interim, some chiropractor down in Florida decided that he was going to advertise it cured cancer. Well, the FDA stepped in, shut him down, and shut the company down. So eventually the founders died of a heart attack, and his lead salesman took over, and the physicist that was working with him, which revamped all the machines when they came from Greece because they weren't wired properly for our wiring,
Mhm.
took over and put a new company together called Pulse Technologies. And to my opinion, they have the ultimate machine out there. It's called the Per 2000. Has all the frequencies needed for treatment. And they're in business today, and they're doing a great job, both in humans and in animals, horses and dogs and cats and everything. What this machine does, large, there's a large electric loop that it's a copper wire, and it runs a current through it. the PAPIMI run 45,000 volts through that voltage through that loop, and the machines out today run probably 20 or 25,000 volts, some of them down as low as 12,000 volts. So you can see why the less voltage, the frequencies usually contract. So we were getting a great magnetic field out of this. Whenever you run electricity in a loop, you'll get a magnetic field. That's what the Dr. Pappas found when they were looking at these cables. So this magnetic field of this PAPIMI machine was about the size of a basketball, which was very good because it had a lot of depth of penetration. And we had a regular routine of utilizing the machine. First, we would put it over the loin for three or 4 minutes, then under the sternum, same time, and then over the pole of the head. And what we were trying to do is stimulate all three major spots to stimulate the immune system and get the endorphins and everything running in that body. And then we would treat the whole body. It would take, for us to do it right, it would take about 45 minutes of treatment. But we would treat the back, the hind legs, the front legs, the lungs, everything. And these horses, the first 6 months we were using it, they had a 50% win percentage. I was in Santa Anita. We went to Del Mar, where the ocean currents are very high, and in the stalls, when the tide comes in, you look down the stretch at Del Mar. When the tide comes in, you can see it undulating. Well, unbeknownst to me, that high level of water under the surface was drawing all of that magnetic field right through the horses into the ground. They were getting no good vibes out of it, and our win percentage went down to 0. We couldn't get a horse close.
Oh no.
So I said, "What's going on?" We were scratching our heads and said, I think that we're losing it through the grounding of this water grounding. So we put rubber boots on the horses, and we had rubber gloves on ourselves. And lo and behold, the wind started going right back up. So from that point on, we started treating them on a rubber mat, so we would keep the grounding process out of the problem. So those are kind of some of the little things we dealt with earlier. But this device is one of the greatest devices for solving pain and inflammation that we have in our hands. And the way it works is basically, in a real quick session, is the magnetic field will cause what we call electroporation in each cell wall. That means the cell wall becomes permeable, and inside that cell there's a sodium-potassium pump. And when a cell gets painful or inflamed, that sodium is increased in volume. And what the PAPIMI does by the electroporation, it takes the sodium out of the cell and replace it with potassium, thereby taking the inflammation and pain out of that cell. And that's what we were finding. The electroporation lasts for about 3 hours. That's the maximum treating ability. But you get the residuals of the anti-inflammation process going on. And with this machine, you can actually tell where the horse is really sore. A lot of times you palpate a back, for example, the sacroiliac joint. You get some pain, but you can't really pinpoint where it is. And we found that by using this machine in a proper way, we could pinpoint a lot of these hard to diagnose cases, because when you hit a spot that was inflamed or painful, we would get a response by the horse. So that's kind of how we use it as a diagnostic as well as a therapeutic device. And to me, it's one of the greatest inventions come a long time to relieve pain and inflammation. I have one in my garage. I got to get it fixed, but if you have a chronic, like a shoulder injury or any chronic injury,
Mhm.
knee, you can solve the problem directly. I'll tell you another story. Do you have any questions up to this before I go to my next story?
I was just curious. I know you said most sessions are usually around 45 minutes. Could you still get some benefits out of it in a shorter session, or does it always have to be longer?
No, you can get you'll get some benefit. We're talking about getting
Mhm.
maximum benefits for the body as a whole. Now,
Okay, gotcha.
if you find a spot that's sore, really sore, we'd zero in on that spot for about 20 minutes. But it's
Mhm.
nothing that you can do 5 minutes and go on. Uh, I've seen people take that loop, lay it on the straw underneath the horse is standing over it, and think they're treating that horse. I got a big clue for them. They aren't doing anything.
Oh my
Yeah,
gosh.
some of them they just wipe it on and do this on the horse all over, and they think they're doing a job. It doesn't get the job done. You got to go
Yep.
methodically and very slowly in each spot, so you can tell what's
Yep.
happening. The horse will tell you where it's sore and what's happening, and those
Mhm.
spots don't give you any response. You can kind of go skip over, but the ones that show you some response, you better stay with it for 20, 15, 20 minutes anyhow to do any good.
I see, I see. Yeah. There was one time where I was at the barn and my friend had someone there that was treating horses with it, and one of the horses, I could tell that when they hit a certain spot, they got really antsy and they had to try to help the horse calm down so that they could use it on that spot and actually get rid of the tightness. It took a bit, but the horse eventually relaxed when they realized that it was helping them.
Right, exactly right. Now, the other thing when you're treating like a knee or an ankle, a hock or a fetlock
Mhm,
joint or a foot even, we recommend two planes. Usually treat them front to back and from side to side, so you get 90-degree angle on your treatment. You do a better job that way. If you do it just one plane, you don't usually get as good a job. We've even put the leg. You can also put the leg inside the loop and stand the horse that way to treat him in that way. But that you got to realize that magnetic plane goes away from the loop. It doesn't go this way. It goes from each side of the loop out, about the size of a basketball.
oh.
So anything from the side of the loop out, you get nothing. It's just from the way the loop is. The loop is the site of the magnetic field. So uh,
Gotcha.
I've seen a lot of people do some crazy things that they think they're treating. All they're doing is wasting time. I had another story to tell you about how it works effectively. Uh,
Mhm,
my grandson was playing football. This is several years ago now. Was playing football for Orange Lutheran here in Southern California. They had a great team, and I had probably 8 or 10 of those football players in my garage every evening after practice, treating them for their aches and pains. And playing football, you get aches and pains all over.
mhm,
One of these kids, a star quarterback, had arthroscopic surgery on his knee. He had a torn ACL. Wasn't torn bad, but they had to shave it a little bit. And they told him, "You can't play the rest of the year." And I told him the same thing: "You can't play the rest of the year." But when he came to me right after surgery, his knee was about the size of a softball because it was right after the surgery. We
mhm,
started treating that knee every day for 15, 20 minutes. Uh, and lo and behold, in about 2 months, well, sooner than that, but the 2 months, that knee was looking normal. And the surgeon said, "Boy, I can't understand what's happening to his knee. It's healed. It looks great. I think you can play." I told him he can't play this year. Well, they were playing a big rival, and they were down 2 touchdowns at halftime, and coach put him in. And he scored 3 touchdowns. He scored 3 touchdowns. They won the game, but he re-injured that ACL, and then he was out for a year. He had major surgery. But that's just a case of what kind of healing this machine will do. We had another player in the machine, was fastest player in the machine, but he had shin splints. He couldn't, so something like a buck shin in a horse. He had shin splints, and he couldn't run only about half or 3/4 speed. We treat him every night, and in about a month, his shin splints gone away, and he got back to full speed. So, and all the little aches and pains you get in your body from playing football, we were able to get them under control. Well, they went on to win the CIF championship that year, and my grandson, this is for bragging rights, my grandson ended up being all CIF middle linebacker. So that was kind of a story I'm proud of.
That's super cool.
It shows how this machine can really be advantageous.
Yeah, that's super great. I know a lot of people recently have been getting the certification for it to treat on their own, and some people start a business doing it. Do you think that um doing the treatment is something that a vet should handle most of the time, or do you think it's okay for the average person to get certified in it and treat?
If they get certified with the PEMF machine, that's just sufficient. You're not going to get any vets to use it. They won't do it because it takes too much time.
Oh,
They'd
okay.
rather use a needle, and I know that for a fact. They'd rather use a needle instead of spending all that time with a horse. But it's like anything else. If they're really interested in treating the horse, they'll look into ways of even increasing the efficiency by their own methods.
Mhm.
It's not a big secret, Bryanna. It's just a matter of knowing the animal, knowing the reaction from the horse when he's got a problem, and when it's
Yep.
solved, and be patient. But we were very, very strict on the way we started. We also always started with those 3 points, 4 minutes a point. The over the SI joint, the lumbar area there, the sternum between the front legs, because that stimulates the thymus gland, and over the pole, because that'll stimulate the brain. And then we start routinely and very scientifically going over the whole body of the horse, one side and then the other, from top to bottom. And that, to do it right, it's going to take 40-45 minutes. They're taking less than that. All they're doing is trying to put a Band-Aid on a severe wound. So it's time consuming to do it right. If a person happens to be a chiropractor, this is the best machine he can have, because after he does his chiropractic and gets all those muscles loose and everything back in the right position, you can go ahead and treat him with a PAPIMI, and all that inflammation and pain will disappear, and that horse will be more relaxed and comfortable than he's ever been. That's what we found with my partner Dave Hand. We used to do that routinely, and that would take about an hour and a half per treatment. But you got to charge for it. It's people will listen. If you have a major stake horse going in $1 million stake,
Mhm.
and he's got a little hitch behind, and you can take it out and he wins that race, they don't care what the cost is going to be. They just want the job done
Yeah.
properly.
That makes a lot of sense. Um, I know you were mentioning that there's a lot of different versions of the machine. Is there a big difference between all of them, or is it just more the amount of field that they have?
Mainly it's the amount of frequency that they have, and I am very familiar because I was a consultant with this company for several years. They are adamant about keeping as many of those frequencies as they can, because it's a broad range of frequencies. And if you can control all those frequencies, you get different levels of healing and different levels of penetration. So the per PER 2000 is a great machine. The MagnaPulse is the other machine that I'm familiar with, and I know they work because we've got a client, a fellow out here that works with us, has one, and he likes that one as well. So those are the two machines that I could probably recommend right off bat. These so-called micro machines, where they give a micro amount of magnetic energy, might be all right for a human. For a horse, you can't penetrate deep enough, in my opinion.
Yeah, I wouldn't think so. I wouldn't think so.
And then they got these electric blankets they put on, the electromagnetic blankets that they put on these horses. And here again, it might warm up the skin and get a little bit of penetration, but they don't get the same depth of penetration this therapeutic machine will give.
Oh yeah, I've seen those blankets too, and I've always been curious about them because to me, I don't know, it's just like how when we put a blanket on, it just kind of covers us. So I never really thought that it, you know, got
But
deep enough to do anything.
yeah, no, you'll just get a minor amount of magnetic therapy. It might it
Mhm.
might it might penetrate an inch or two, but if you got a lesion down underneath the SI joint, that's about a 6 or 7 inch depth. You can't get to it.
Gotcha. That is definitely something to keep in mind too. Um, I know there's other different um therapies out there. I think like the Beamer one with the blankets was um kind of similar to using the pulse electromagnetic field. Um
Yeah, that was
I'm
the
just
blank referring to, the Beamer.
yeah, I'm assuming they were all kind of created for the same purpose, but it's just interesting to me that one person saw it and was like, "Ooh, we can put this in a blanket and then the horse can wear it." Like I always
Well, it works
wondered where
probably
the
all
idea
right for
came
human,
from.
but
Mhm,
for horses is a different game. There are also other electromagnetic machines out there, and there's a lot of lasers now coming out that are very good. So there's
mhm.
a lot of different uses, and depends on what you're trying to accomplish, what machine you're going to use, basically.
Got it. Got it. Sorry, I know that question, like, my thoughts were coming out kinda weird. I didn't quite know how to phrase what I was trying to say, but
Well, that was
that
fine.
makes
It came
sense.
out fine. In fact, there is a couple of therapists back east we work with that use all of those devices.
Mhm,
And one of the gals is an acupuncturist as well. And she remarked, and she blew me away when she said this. She said, I'm horses that I'm using this BioPro Armour on routinely. I'm finding that the joint, the acupuncture site pain threshold goes down. They're not as painful in those thresholds, those areas where I'm doing the acupuncture, as they were before we started using the BioPro. So the horse have been on the BioPro Armour for maybe 2 or 3 months to get that, but the healing from the BioPro Armour also helps decreases inflammation and pain levels. So that's just another use. It's another piece of the puzzle to solve the pain problem and inflammation problem in horses. They do go
Oh,
hand
that's
in hand.
that's really neat. I didn't think about that, and I also thought it was interesting how you brought up at the beginning that it was originally a cancer treatment because I hadn't or a proposed cancer treatment, because I had no idea about that. So that was really interesting too.
Yeah, I'm sure it would do it, but in the United States, you can't say anything about curing cancer or treating cancer because the FDA, they're in business with the big pharma, so they're not going to say anything that's in regards to that. Yeah, we can't. Basically, everything we do, we can't say it cures or treats or prevents anything. This is just a
I
supplement or
see. Yeah.
a procedure to try to get the body in shape.
Yeah, that makes a lot of sense. Well, those were all of the main questions and thoughts that I had in mind. I appreciate your time again, Dr. Warren. It was really informative and I learned a lot today, so I appreciate it.
Well, good.
Mhm.
Yeah, it's a device that we're just here again, like BioPro Armour, we're just scratching the surface as to what it'll really do. We've used it on lungs when horses are bleeding with the BioPro Armour and the PEMF over the lungs. That helps to heal those lungs as well, get rid of some of that scar tissue maybe, and help heal those lungs. So there's a lot of different things you can use it for, but basically as a general aid to reduce inflammation and pain, I don't think there's a machine out there that can stay close to it. I would, if I had a choice of all the machines out there, the electromagnetic devices, this device, that device, it would be the PEMF machine that I'd choose because I know it'd do more good overall than all the rest of them put together, probably.
Yeah, and now that I know more about how it works, I would definitely want to give it a try on my own horse someday because I have more of an idea of how it could be beneficial. And it came from a more trusted source through you. So I know now that it's actually as good as people claim it to be.
Yeah, it's great. Well, listen, this is a great discussion, and if any of your clients have any questions, let's get them on the horn and we'll talk to them and try and answer all their questions because that's what we're here for.
Sounds good. Sounds good. So before we end our discussion today, I just want to remind everyone that you can find BioPro Armor on social media at BioPro Armour. All our pages are just under BioPro Armour. And I'm gonna be putting up the next Ask the Vet question post on Saturday. So if any of you guys out there that are watching this decide you want to submit a question, the next one will be going up on Saturday, and hopefully we'll have another productive discussion. And I really thank everybody for watching, and I hope you have a great night.
Thanks, Brianna. Have a great week.
Thank you. You too. It was great talking to you.
Bye bye.
Bye.